Welcome back to Morning Express. It is 8:36 a.m. and last week, a sad, tragic, heart-wrenching story broke, and we heard about the mother to Mukurweini MP Kabando wa Kabando, Rose Wachera Mwangi Kabando, was buried at her Ngamwa home in Mukurweini constituency. 23 members of parliament were in attendance and consoled the MP and condemned those engaged in drug trafficking. Kabando's younger brother, Caesar Thiari, who murdered his mother last Sunday, is said to have been under the influence of drugs when he committed the atrocity. Nakada, though, through its chairman, John Mutudho, who attended the funeral, vowed to continue with fight against substance abuse. But that also is put in the bigger picture and the larger conversation around mental health. And that is what we're going to be talking about in our lifestyle segment. But let's have a look at that clip just before we get into our discussion this morning.
It was the burial ceremony for the late Rose Wachera Mwangi Kabando, mother to MP Kabando wa Kabando in Ngamwa area of Mukurweini. As leaders consoled the MP, what took center stage was the manner in which the deceased lost her life. Her son Caesar Thiari allegedly hugged her to death last Sunday. The family has since admitted that Thiari, the last born of the family and who is currently in police custody over the murder, has struggled with drug addiction for over a decade. The 23 members of parliament and other leaders present condemned those behind drug trafficking in the country.
Nisikia kwa nyumba kuna mzazi anasema nataka kupigwa na mtoto yake, enda haraka saidia atauawa haraka.
Uhakikishe hakuna hiyo pombe ya haramu, hakuna hiyo madawa ya kulevya.
Kama ni mambo ya siasa, mtu anakuja na pesa chungu nzima, anapelekea wananchi wanamchagua na ajui hiyo pesa ilitoka kuuza dawa ya kulevya.
They know who are selling these drugs, where, and they can apprehend them anytime they choose to.
Nakada chairman John Mutudho sought to assure Kenyans that the fight against substance abuse was on, but would require the input of all stakeholders.
Wale polisi ambao wanashiriki katika mihadarati, they should also be charged under the same act of 1984. It is not possible that mtu ameketi hapa ni drug addict ananunua kila siku na watu wako na hajashikwa.
The Cabinet Secretary for Infrastructure, Michael Kamau, who read President Uhuru Kenyatta's tribute, said the government had stepped up the fight against the vice and had made considerable steps.
JKIA, kila siku sasa tunanasa. Kila siku. It's only we are not sending it to the press, but I tell you, we are arresting very, very many people at JKIA.
While paying their last respects to Mama Rose Wachera Kabando, the leaders present asked the relevant authorities to ensure that the drug menace was dealt with once and for all, especially seeing the damage that it has caused families. Carol Derry, KTN, Mukurweini, Nyeri County.
And with the question of drugs coming into play in that particular incident, of course, that's said to have also affected, and it's one of the things we'll be delving into this morning, his mental state. And earlier on, we ran a story, and also ran yesterday, about a mother who burnt her son, again, no matter what anger, whatever somebody has done to annoy a parent, to go to some extremes in punishment. Some of the issues that we see unfolding in our society, that raises the question, is all okay? And that is what we want to focus on this morning. My guest is Dr Catherine Syengo, and she is a consultant psychiatrist, and we thank you for being with us this morning, Dr. Talk to me first about when that story broke and you heard about it. What went through your mind?
What went through my mind when I saw that story was that that was a client who needed psychiatric evaluation, because any case of murder, before they are taken to court for the hearing to continue, they need to be evaluated by a psychiatrist, yes, to be sure whether they have mental illness or whether they are of sound mind by the time they engaged in the crime. Yes,
we're hearing from that clip a lot of the drug concerns that even the family had, knowing that he was taking in a lot of drugs. For you, is it that, would you say, is the main problem, or would you say there could be still and drugs in and of themselves alter the mental capacity of a person?
Yes, drugs alter the mental capacity of a person. They also remove inhibition, so people would do things which they would not otherwise do. And we are seeing a lot of violence being contributed, drugs contributing to a lot of violence. But like I had said initially, that the client needs evaluation. I have not evaluated him myself, but drugs can contribute to that. Other types of mental illnesses can also contribute towards that.
Okay.
Yes.
Talk to us about mental health. Introduce us to this subject, because very many people are affected by it. And one of the very huge campaigners of this and to bring attention to the subject has been Sitawa Wafula. I don't know if you've heard about her.
Yes.
And we even have talked to her on this show. Just trying to bring attention to it. Explain to us, when we're talking about mental health, what are we talking about?
Actually, when we talk of good mental health,
yes,
we are talking of somebody who is able to reach their potential, somebody who is able to adjust to adversities, because life is ups and downs. There will always be adversities in life. So if you are able to cope well with your adversities, then we say you are of good mental health. If you are able to relate well with other people, we say we are of good mental health.
Yes.
Outside of that, then if you have problems with that, now we start talking about mental health problems. When it is now severe to the extent that it has been going on for a while, it is affecting your social relations, it's affecting your work, then now we talk about mental illness. So it's a spectrum, starting from good mental health, and the extreme is mental illness. Yes.
Okay.
Yes.
Well, what causes the problems? Talk to us about the mental problems.
Yes. When we talk about mental health problems, they range from one, genetic predisposition. A lot of them have a lot of genetic predisposition. Even drugs, we know addiction. Even for alcohol, for example, you've seen families where you had a father, a grandfather who had was addicted to alcohol, and it was also, you find the children are also getting addicted to alcohol.
Yes.
But that doesn't mean that if you're in that family, you automatically become addicted to alcohol. It requires you to be exposed. It requires a trigger. When we talk about the other mental illnesses per se, when we talk of depression, schizophrenia, there's also a genetic predisposition. Again, now we also talk about stressors, psychological stressors, or trauma, like somebody who has experienced severe trauma, like the Westgate issue, or like the what is happening in Lamu. So what we call post-traumatic stress disorder. So exposure to trauma, environment, stressors. We know that children who lose their parents when they are young, they are predisposed to later on getting mental illnesses.
Yes.
And then we have substance abuse. We are seeing a lot of substances being abused, especially in Kenya, ranging from alcohol to cannabis to miraa, and the hard drugs, the heroin and the cocaine. They also contribute a lot to cause of mental illness. Again, we also have physical problems causing mental illnesses. For example, if you are suffering from cancer, for example, you could be predisposed to getting depression. People with thyroid disease can actually present as a mental illness, with symptoms of a mental illness. Cushing's, there are many general medical conditions which can actually present with psychiatric manifestations.
Okay.
Yes.
So it's a wide range of issues and diseases and problems and causes and triggers, as you've been highlighting, that would bring about this problem. But in as far as society and understanding this, how receptive are we? How cognizant of the challenges these people face and helping them tackle this is society? Because one of the challenges we've seen highlighted over and over again is that society itself, especially here in Kenya, you want to hide them, you want to lock them up, especially those with the very extreme cases of mental illness. Why is it that there's that sort of shame? It becomes like a taboo, even conversation in most homes.
Yes, mental illnesses are stigmatized in Kenya, and as a result, people don't want to be known that they suffer from mental illnesses. In fact, we have cases where in the mental hospital, Mathare Hospital, or even when they go to see psychiatrists, they don't want any letter written appearing to be coming from a mental hospital or from a psychiatrist, because they feel that when they take that letter to their workplace, or when their friends get to know that they were being treated by a psychiatrist, that they'll be stigmatized. So we need to fight stigma, because mental illnesses can affect anybody, regardless of your social status, regardless of your education. It cuts across. So then it's just an illness like any other. Just like when somebody has diabetes, some will need long-term medication, others could be treated for a short period, others might not even need medication, it might just need psychotherapy, the talk therapy, and the person will be well. Others will just be counseling to be told how you need to manage your stress, and then you are able to move on. So we need to move out from that stigma, and we can move out from it if people are able to come out and say, I'm suffering from this mental illness, and I'm able to move on with my life. Because there are people we treat, they go back to work, they go back to school, and they are productive, they are taking their medication, but when you look at them, you can't actually tell that they're sick. Yes.
Yeah, because some of the things we hear associated to mental illness is witchcraft. You hear people saying those ones must have done something against the Lord, and they've been punished. So that debunking of those myths and coming to a place of acceptance, you say, would be a great place to begin.
Yes, exactly. In our setup, remember, I've said that some mental illnesses have genetic predisposition. So you find that if in the villages you have a family which has more than one member suffering from mental illnesses, they would say that family is cursed, they stole something, or the religious background will also say they must have sinned, they need cleansing, they need prayers. Not that I don't believe in prayers, but as much as we are praying for them, they actually need to get medical treatment. Yes. Okay.
Because one of the concerns that people would have is when you talk about the genetic cause and trigger. What does somebody do if there's a person in their family that is suffering from mental illness, in ensuring that perhaps they don't face the same fate or go down the same path? What do they do?
Yes, basically we are saying there are some things you can change. You see, you may not change your genetic predisposition.
Correct.
But you can change the environment. For example, right from childhood, if a parent helps a child to develop self-esteem, then it means that they are lowering chances of them getting depression, as much as they might be genetically predisposed.
Yes.
Again, as you in adult life, if you manage your stress as well, you prioritize your areas of life such that you are not overwhelmed, then also you are changing the environment. Again, if you avoid, we call them mood altering substances, all drugs of abuse, including alcohol, including cigarettes. If you avoid those ones, you're also working on the environment. So as much as we may not change the genetic predisposition, then we can change the environment, which, because again, even those who have genetic predisposition, they require a trigger. So that everybody who suffers from a mental illness, you can trace back what was the trigger, what trauma, what stress did they go through. Again, when you improve social relations, because social bonding, social relationships helps a lot. And again, people are spiritual also, because they believe there's a higher power which will help them tackle their problems. They are able to manage. So there are things we can alter and work on. And even those who are genetically predisposed, if then they get the slightest symptoms, then they need to seek treatment, because we know the severe mental illnesses like depression and schizophrenia. The earlier you start treatment, the faster the recovery and the better the quality of life. If you wait until the disease has progressed, then you find that the quality of life, because mental illnesses might not kill you directly, but they will debilitate you, you will not be productive, and again you lose, in fact it increases the rates of poverty. Yes.
Yeah, because we felt it was important to have this conversation, because more and more some of the stories we're covering and we're seeing are disturbing at every level, that make you wonder and question, why would a human being do that? Recently there was, I think it was a CID officer who, you know, went home and killed his wife, then killed himself. I mean, there's all manner of things happening. The story I was mentioning earlier of a mother burning the hands, I think, of their child. So what is going on in society? Why is it we're seeing more and more of these cases? And for you in your line of work, what is it, in as far as mental illness and the problems, is the most common challenge, or, you know, the problems that you see most frequently?
Yes, actually there are far more cases which are not even highlighted by the media, because because like in Mathare Hospital where I also work, you find that we have a whole forensic psychiatric unit where we do those psychiatric evaluations, and you find that every week we do the clinic twice a week, Monday and Thursdays. We have like 5 cases of murder who are coming to assess and for assessment. And we also have patients who are committed there by court because they were found to have committed murder, but they were unwell. They were insane at that moment, so they are put there for treatment. So the rates are higher than what is shown on the media, and stressors are increasing in our society. You have poverty, you have unemployment, you have generally breakdown of the social stress structures, because before you would go to the extended family if you had a problem and they'll assist you. So as we become more urbanized, those social traditional structures are breaking down. So stressors are increasing. So that's why we are seeing more rates. Again, even when these rates of insecurity increase, that anxiety of I'm not sure whether I'm safe or not, you find like now if you went to a place like Lamu, you'll find the rates of anxiety, which is also a psychiatric disorder. The rates of anxiety must be higher than any other areas, because this is a place which has been experiencing insecurity for some time now. Okay. So as stressors increase, then you also get increased rates of mental illnesses. As drug abuse increases, you also get increased rates of mental illnesses and misbehaviors also.
You mentioned Mathare Hospital, and it's one of those, people will not talk about it much. Some, unfortunately, even I was reading an article that described it as just this madhouse that, forget about, this group of people. But these are people that need help. What exactly are they taken through? Because sometimes it has been argued that the hospital in itself, because of the condition, the environment, sometimes make the situation worse for these people than better, than actually helping them out of it. But, it becomes worse, that it's like a prisoner put in a dark situation that they need to be able to get out of that place they're in. Okay,
first of all, I would want to clarify,
yes,
the hospital, Mathare Hospital, cannot be worse than watching the patient deteriorate at home.
Okay.
We might have our own challenges, but certainly the patients and clients who have gone through there, or the relatives who have brought their patients there and they have taken them back home, they appreciate that this person, when I was bringing them here, they were unmanageable, and I'm taking now home a patient who can manage themselves, a patient who is well. And actually, as much as people talk negative about the hospital, we have actually many people waiting to get in. You find that we are always overcrowded. I mean, there are more patients than we can manage. You also find like our drug rehab, which accepts NHIF. We find that booking are like 1 month in advance. There are days you can go book for a bed in the rehab there, and you have to wait for 2 months because it's in demand. So again, when we tell the public that general psychiatric hospital is worse than being at home, then what do the poor have? Because that is the hospital, they would get help. We are continuing to improve, and that's why we have continuous medical education to continue and improve. But I would still say that if you have a patient with psychiatric illness, they are safer in the hospital for treatment than letting them deteriorate at home. Yes, but we are improving. We agree we have challenges, and we are continuing to improve.
Okay, because again, the criticism for the government on their part has been in terms of the involvement in mental health, because creating that awareness that really this is not some devil, it's a disease, it's a condition that can be treated. That is lacking, especially in the grassroots areas. For you, what do you think? Because we've only seen non-governmental organizations coming up to be able to raise this awareness. What do you think that needs to be done to mitigate on this, to help curb this scenario, so that we stop perhaps seeing more of this very gruesome stories we're hearing about day in, day out?
Yeah, I would say the government is improving on their part also, because there are things which they might not know, the public might not know. For example, Mathare Hospital was last year elevated to a national teaching and referral hospital. That meant that the allocation which goes to patients' drugs, goes to the patients' meals, goes to the patients' uniform, goes to the patients' welfare, cleaning materials also increases. So if that is increased, then the services are now increasing. Before, we could only afford to give patients what we call first generation antipsychotics, which had so many side effects, and you look at that patient and you see like they are becoming like too drowsy. But now with the increased allocation, we have what we call second generation antipsychotics, which are also being used in the private sector. And you find that when patients take second generation, then they become stable, and you can't tell that they're on medication. So I would say the government is doing on their part. We also have companies like Safaricom is through Kenya at 50 is renovating 2 wards because congestion and old buildings, because these are very old hospital, has been a challenge. So we have private sector also partnering with us, and every other company, every other NGO which is willing to partner, they are welcome. But I must also say that every county referral hospital, what we used to call the provincial hospitals, also as a psychiatric wing which can also attend to clients. Again, the government is also training in service nurses and clinical officers to be able to diagnose at the health centers and the dispensaries. There is the in-service, the ones who are already in service, and there is the ones who are being channeled out from medical training colleges. The nurses and the clinical officers are also being trained in mental health, so that when they go to the grassroots, they go to the health centers, they can also be assisted at that level, and again they can be referred, so that if they eventually need treatment at the referral hospital, which is Madari Hospital, they can come there. If it is something which can be handled at the dispensary, at the health center, it can still be handled there. Yes.
Finally, Dr. as we bring this to a close, what for you is the take home, the most important thing in this conversation around mental health for the government, which you've touched on quite a bit, but also for the general public, especially those that may know people who are suffering from various illnesses or see signs and are not sure? What does one do?
Yes, with mental illnesses, the patient will rely on the family members or the friends to take them to the hospital. Because when it's severe, the person doesn't realize they are unwell. And most of the time you have to take them to the hospital against their wish. Because if they are hallucinating, they'll say, what I'm seeing is real. So they don't understand they are sick. And if you keep convincing them to go to the hospital, they will not accept. So if you see somebody who is behaving abnormal, you need to take them to the hospital. For the mild cases, if you feel you're not managing with your stressors, if you feel that you are not adjusting to adversities, that you are not relating well with other people, or you're not reaching your potential. There are people who are depressed, lying in the bed, they are not going to work, and they have not realized they are depressed. So when you get those symptoms, it's good to seek treatment. You'd rather be evaluated and told you're okay than to wait until it progresses. Yes.
Okay, and you see a lot of people just sitting, and especially when in town, just there, day in, day out, not looking for a job, they're just there.
Yes.
So I think...
and then the other issue is people need to have a healthy lifestyle, exercise, eat a balanced diet, manage your stress, prevent physical illnesses. Remember, I said if you have pain, there is no way you're going to be happy. So when you manage also the physical health, then you also end up having good mental health. Yeah,
because that will weigh in on the mental health as well. Thank you very much, Dr. Catherine Syengo Mutisia, for joining us this morning, consultant psychiatrist at the University of Nairobi as well. You're with them, and we appreciate you for shedding light for us this morning on mental health, because a big problem with the country, perhaps more people needing to hear about what you had to say, and also pay more attention to their loved ones and to themselves. As you said, life will always have challenges, and it's about how we go about handling those to ensure it does not weigh us to our graves. Thank you. For the feedback this morning, we thank you for watching the show. Time is up, 8:59 a.m. Calvo, keep simply saying you're watching the show. Thank you. Mwinzi Joseph, what an awesome show with James and yours truly. Thank you. Arthur Thomas, you comment on the conversation we had earlier on the way it is on land. And you were saying address historical injustices to solve the land issues comprehensively, and you agree it's definitely a cancer and a deep-rooted problem that has to be dealt with from the very bottom. Joseph, you say the show is great. Kudos for not making the show a political zone. Well, yeah, cannot make it a political zone. Punk John Gucci, epic show. You love us. Thank you for loving us. We love you too. Have a nice day. Kevin Ogwoko, it's naive to equate consequences of implementing TJRC report to Zimbabwe qualms. The report was just and rational. Mugabe wasn't. Those are your thoughts. And as far as the TJRC, having also touched on what the now issue of land grabbing, alleged land grabbing in Lamu is concerned, that it had talked about the same as well, and we'll watch to see how the now investigations that have begun, what they will bring out. Matthew's historical injustices started with Adam and Eve, you say. Let's be practical and address land grabbing. Kevin Onyango has thrown a good question. You said that was a good question. He was talking about the TJRC report earlier. And the final, Erickson Macharia, final comment I'll read. We are tired of shouting for a losing team. Even mothers get fed up with their Danda sons. We want results. We want results. That's what you're saying. I guess everybody would agree with you that as a country, you don't want to be revolving around the same issues, cutting around. You want to be able to move forward. And as those investigations were ordered and directives given, of course, the country will be watching and will be covering for you, tracking those stories to bring you the latest developments as and when they happen. Remember that U.S. Africa Summit going on in the States. We are covering that for you. You have Joe again in the United States of America. So we'll also bring you developments from that. 47 heads of state expected to be in attendance. Today as well, the IEBC expected to give direction in as far as Gatundu South is concerned. Will Moses Kuria be announced a member of parliament? Will they still go ahead with the election with just one person in there? We'll see. So keep it KTN for all those developing stories and of course so much more. I'm Sophia Wanuna. Have a lovely day. We'll see you tomorrow.